now coming to the next part is like कि बहुत कॉमन होता है कि व्हेन वी आर एन एथलीट और यंग हैं हम एंड वी ड्रामेटिकली इन्वॉल्व इन सर्टेन एक्टिविटी जो कि हमारे नी में पिवटिंग या जंपिंग एक्टिविटीज़ रिक्वायर करते हैं, तो उसके बाद आपका कोई लिगामेंट इंजर हो गया या आपका मेनिस्कल इंजरी हो गई, सो आई शुड स्ट्रेट अवे गो फॉर अ सर्जरी. Definitely not. Many of the tears and the ligament healing can happen with rehab only. So these myths are really, although some of the myths I have talked in the previous session also, in which previous session like whether to opt for a surgery or not for the older adults, but in younger population simply if we do some dancing activity or the things that require sudden movement of the foot or sudden jumping activity we have done, sudden jumping drill that we usually do. हम इतने enthusiastic होते हैं जब कि बहुत दिन से कुछ नहीं करा बट अब गोल डिसाइड करा है रीच करने का, सो वील ट्राई टू रश. So in that sometimes the injury happens and it's not always that कि वो heal नहीं होगा with rehab. It's not always required that you need a surgery. Again, you need to consider many factors. Even after the surgery, you need a proper rehab program, and how much rehab you would need will depend upon your pre-surgery level. That whatever strength you are having previously before the surgery I will also determine that how fast you will recover after going for a surgery, whether it a meniscectomy or a repair, ACL reconstruction, but all these, either the ligament, either the meniscal, anything can be just conservatively also treated. So there the factors are like कि कितना grade of tear है. Sometimes it's not, I'm saying कि surgery is a bad option, but you have to consider that whether it is the best option or not. And so अगर grade 3 tear है या फिर अगर location of the meniscal tear also plays an important role कि कौन से location पे हुआ है, if it is having a good blood supply or something like that, then it will heal properly. So knee health in the youth, primary thing that you have to keep in mind is that usually in the youth the knee pain that happens whether interiorly or in any location is most primarily because of the muscle imbalance. So you can just work on that. You go to a proper take a proper assessment and you can just see what are the muscles that are tight, what are weak, and then take a proper rehab. And I would say don't ignore it. What mistakes we do is like we just keep going with the pain. When it exceeds our threshold, जब वो start होने लगता है कि आपके daily activities में अब इन्वॉल्व हो रहा है तो अब मैं जाऊँ, मतलब इफ़ यू फील लाइक कि नी पेन परसिस्ट कर रहा है, इट्स नॉट गोइंग विद द रेस्ट, इट्स नॉट गोइंग विद द आइसिंग, इट्स स्टिल इट्स परसिस्टिंग, then please go for the proper consultation. Identify your knee primary reason, that what is the underlying cause for the knee. So I just emphasize again and again, be it my previous session, be it my this session, is because कि knee में pain रेफर भी हो सकता है. मतलब इट्स नॉट कि नी में कोई इंजरी ही है तो नी पेन आ रहा है या नी का स्ट्रक्चर में कुछ है तो नी पेन आ रहा है. समटाइम्स द बैक पेन can refer to the knee foot alignment that I had talked previously also, and this time also I am telling, because youth में we always keep on going with the trend, मतलब high heels and our walking pattern. We don't even if we are noticing कि हमारे foot का alignment या जो foot placement है वो proper नहीं हो रहा है, then also we keep on going with it. We don't think about it कि क्यों हो रहा है, then उसकी वजह से भी आपका knee pain होगा. And so don't मतलब wait for too long, मतलब just see if after few weeks also the pain is persisting, then have a consult and get it sorted. And it's majorly because of that muscular imbalance. And the other thing that I want to talk about is the one last thing that I need to share is the how we can treat that knee pain. Give it a proper rest first. Second, do a icing. If you find there's a swelling over there, do a icing over there. Then third thing is have a that stretching. Do some exercise, stretching your tight structures and doing some basic exercise around the knee. That will help you to just get rid of the pain. Then what things that you have to keep in mind is like footwear. If you are having a knee pain, get a look of see your footwear is fine or not. Second thing is that if you are a runner, keep a running diary. It's very important. It will help to identify that whether how much intensity you are running, and if there is any change in the intensity of running recently or not. So and how at what pace you are running. So have a running diary with you, properly maintain it. Then also just take care that if you suddenly start having a knee pain, before that it is normal, then see if there is any change in the footwear you have done recently, or the walking, the floor on which you walk, whether it is concrete or whether it is a mud floor on which you are walking. Usually walking on a concrete and uphill might lead to the knee pain. So these things you may consider, and if because of that is happening, you should just stop that or alter that and just go back to the start and see what is the go back to the start, literally go back to the start, see the strength of the muscle, then see the flexibility of the muscle, then have a proper knee, have a proper healthy knee, and then resume the activity. So that it will not get aggravated, and you'll keep on just achieving your goals whatever you were on. So you don't have to just stop for a month or 6 months or so and then do a proper rehab and then do it. If you're feeling like that these changes has happened recently, just switch the changes. Be first make yourself ready for those changes, and then again you can resume it. Okay, so another thing that is common in the when the youth will we usually want to take immediate relief. So we directly go either for the change in the diet के diet से knee pain solve हो जाएगा. That I've already cleared that it's not that such thing कि raisin खाया या eggplant लिया and then your knee knee pain will go, not like that. And even if you are taking painkillers just for a temporary relief, then also it's not going to help you a lot. I have mentioned earlier also there are lots of downside of being regular on your medication part, and making a habit of taking a painkiller whenever knee pain happens. So it's not good even for the youth or for the older population. So don't do that. Just have a proper assessment that why that knee pain is actually happening, whether it's bursa, whether it's tendon, whether it's actually the joint, whether it's post injury, whether it's a biomechanical issue, whether it's a muscle balance. Identify the cause, then look for that, and then address that cause and move forward. So these are the major things that I want to talk for today's session, and hopefully I think that it might help you a lot. So thank you very much. If you want to ask any question, you can ask. Otherwise I'll just wind up the session for now. So I don't think there's any question over here. So have a nice day, and if the session help you even the little bit, then it would be a great. And if you are facing any such issue, do consult properly, and we are always here to help you. Thank you very much.